Hi, my name is Crystal, and I was diagnosed with adrenal exhaustion in February of 2015. After having a consultation with Dr. Lewis, he noticed that I was shaking and suggested that I come in for a consultation about my adrenals. And during that consultation, he nailed everything right on the head. I am a business owner, I'm a mother of 4, and I help run a farm, and our lifestyle is extremely busy, and I just thought that my body was tired because of our busy lifestyle. So we went through with the adrenal testing, and the results that we received were actually quite devastating. After I left my appointment with the results, I cried because you go through this somewhat of a denial process of, okay, this is bad, but we can fix this problem. And Dr. Lewis was always very encouraging in the supplement regimen and the length of time that my recovery would take. So we started an initial supplementation and expected to take about 4 months, but after I'd gotten my initial test, before we got the results, that's when things really started to get scary for us. As a Christian, I am someone that does not live without hope, and things began to complicate, and I started having suicidal thoughts. I'm always a vibrant mom, play with my kids, but it became a point where I was hiding in my bed, covering my eyes or covering my head to right here, asking my husband to take certain things out of our room, limit my exposure to our kids, and that's not the kind of person that I am. And we knew that there was a problem. And then when we saw the results, we knew that part of those thoughts and feelings were associated with the adrenal exhaustion. And through this process, I started taking 30 different supplements a day. It sounds like a lot, it is. And then started also meeting with Stephanie Baker, who's a counselor here that Dr. Lewis recommends that you partner with during your journey of healing. One of the other things that Dr. Lewis also recommends is that you change your diet, your exercise, your personal care products. That is something that I had already done. And to know that I had already taken those steps toward healthy living, yet my body was still not healthy, was really eye-opening to me as far as a supplement regimen. And through the course of the last 4 to 6 months, there were a lot of highs, there were a lot of lows. We had great strides and then also setbacks. But throughout the entire process, you could see your body was healing. My energy level would go way up, and sometimes I would get tired. My kids started noticing that I wanted to be out of our room more. My business has always been thriving, but I needed to connect on a deeper level with individuals and their health journeys. And this process of resetting my adrenal gland, it was challenging, but Dr. Lewis walked through that process with me and saying, okay, this is normal. We're going to get to the end. Because at one point in time, I think with multiple people that I've spoken with who've had adrenal exhaustion, you get to the point of saying, am I going to get better? And about that time, you start to see the breakthrough. So it's September 2015, and we've really seen a huge stride. I'm no longer on any supplements. My energy level is back almost 100%. There's a lot of laughter in our family now. The stressors of life don't affect me and bog me down. And again, I'm a business owner, I'm a mom of 4, and we have a farm. So our life is very busy. And now that my adrenals are reset and functioning the way God designed them to function, I'm able to live the life that not only do I want to live, but that my kids enjoy me as well as, and the relationships that I've built through this process and the testimony of what I've gone through to where I am now is just amazing. So let me encourage you. You may have that healthy diet, the healthy personal care products, the healthy exercise. But if you're feeling tired or sluggish, go in and have that consultation with Dr. Lewis. It doesn't hurt just to have those adrenals checked out to make sure that your body is functioning properly. And if it isn't, and there's a couple little things that need to be tweaked, it's so much better to get a jump start on it now versus waiting until you're like me, in bed, not wanting to spend time with your family. You want to live a life that's thriving and not just surviving. And now I can say that we are now at that point where we're thriving and we're just loving life. And I just really encourage you to do that adrenal testing.